Hello, I'm Alys Cole-King and I'm the Clinical Director of For Mental Health. And I'm delighted to tell you a little bit about the Connecting with People training programme. We work with many different organisations around the world, and also we are delighted to be working with the University of Wolverhampton, and in particular their student nurses. Now, I think most people would think that suicide and self-harm is a very challenging topic, and certainly when you're a student it can feel maybe perhaps a little bit overwhelming to think about our role in helping somebody who is distressed and at risk of suicide. So if we consider for a moment how people's knowledge develops and deepens, initially we become aware of the situation, but actually awareness on its own is not enough. We then need to develop the skills and the competencies, but also the confidence to respond to somebody with compassion and safely. We think that safety planning is a big part of this. And then obviously when somebody has the awareness, we hope they then will very quickly get the training that they need in order to help them with their work. Now, these are the things that we know make a difference when somebody is distressed or when somebody is at risk of suicide or self-harm. So the key thing is that that person needs to know that they need help. So they need to be aware, because actually admitting to themselves, that's the first big step. Of course, the person they then approach, they have to be compassionate, to be understanding, and to have no stigma. So it's really important that we tackle these things first. Of course, self-care is vital, and I think this is particularly important at the moment. And we know that nurses and all other disciplines working in health and social care, we look after other people. We don't always look after ourselves, not as well as we should do. So it's really important that we build our own emotional well-being on our own resources, and of course help people see that help seeking is important. Obviously, healthcare has a role, but you can see that all these things add up to making a difference. So the way that we've designed the training is that the lower level of competencies are gained first, because clearly you have to remove the fear. You then have to help people see the importance and the value of compassion. And then obviously then once that is reached, we can then teach the basic intervention skills and then obviously the more complicated intervention skills. So in order to do this, we have a range of modules. They're like building blocks and they follow one along from the other. So we know that it's important to get the awareness, but then of course you need the skills as well.